So we've also heard data at this meeting about the ALTA study, which is SB-525, which is an AAV6 containing a factor VIII gene. So we have had some of that data through the press releases that we've heard, so it's been really nice to see that data presented at a formal scientific meeting. 10 patients have been treated in 4 different dose cohorts. So the one that has generated most interest is the highest dose cohort, where there have been 4 patients that have gone through. That 3 patients that have moved through have essentially all got normal levels, above 50 units per deciliter and some above 100 units per deciliter. One patient is much earlier on in the program, so we wait to see what's going to happen with that. So that's really a very positive data that we've heard. Patients treated at a lower dosing have had much lower expression levels, and there seems to be quite a steep dose response curve in the data that's been presented between the 2 high dose cohorts. Now clearly it's relatively early days, but much like any of these gene therapy programs, when you express good levels of clotting factor, whether it's 8 or 9, you see a profound reduction in treatment requirement and treatment bleeds, and we've seen that again here. The safety of the ALTA study that we saw yesterday was pretty favourable. One patient developed some hypotension at the time of infusion, but that aside, there were relatively few adverse events that we'd be concerned about. The one that everybody though focuses on with all gene therapy is ALT rises, and there were 3 patients that had ALT rises, 2 in the highest dose cohort who were treated with tapering courses of steroids. Importantly though, there was no reduction in transgene expression in association with the ALT rises. So overall, a fairly expected pattern of safety, which is naturally encouraging. So we look forward to seeing this data playing out over a longer period and how it's going to behave. The one question that we all have, again, though, for any of these programs is seropositivity and pre-existing antibodies, and how much these are going to play into accessibility of treatment for individuals for various programs.